So this all started 3 years ago in March 2022. Early March 22, we got the news that my eldest nephew, the eldest grandchild of the family, had been diagnosed with a very rare disorder, which is life limiting. And essentially, we were told that there was no treatment and that this condition had a poor prognosis, and that from the onset of symptoms to death would be 10 years. And in terms of onset of symptoms, this would have been the first seizure that he exhibited when he was around 9 years old. So actually, my nephew was misdiagnosed with having epilepsy at the age of 9. And it was only when he was 15, in March 22, that he ended up having a prolonged seizure and started showing other signs and symptoms for the medical team then to further investigate and find that he'd actually got a condition called Lafora disease. Many people, I don't think I've heard of Lafora disease. I hadn't heard of Lafora disease. Lots of my friends who are doctors or are within the medical field hadn't heard of Lafora disease. It is very, very rare. At that time in 2022, I believe my nephew was the only case in the UK. So what I did was, I just started looking into the condition and started carrying out research. I managed to get in touch with a doctor in the US who is actually the leading expert on Lafora disease. I also found out about an organization called Chelsea Hope. So Chelsea's Hope is a charity in America, and it's the biggest or the only charity for Lafora disease. So I got in touch with that organization. I also spoke to my kind of nearest and dearest and my inner circle, my close friends, and one of them messaged me and said, I've just had to think about what you've told me about your nephew, and I remember a number of years ago I used to work as a carer, and I used to care for children who had something that sounds very similar to what your nephew's got. So would it be okay for me to get in touch with the mum of them children just to find out what condition they had? And I said, well, of course, yeah, if you can get some information from me, yeah, I'll welcome that. So she got in touch with the mother of them 3 children. Now, sadly, she lost all 3 of her children to Lafora disease. Anyway, she informed that mother that my nephew had Lafora disease, and she confirmed that her children also had Lafora disease. Now, coincidentally, it just happens that she also lives in the same city that we live in. I mean, what are the odds of that? So I said to my friend, would it be okay for you to ask her whether she's willing to come and see the family to just tell us what we're to expect? And she agreed straight away and said, well, of course, it only makes sense for me to come and tell you what I went through and to support you and tell you, which way you're heading, what to expect, because this condition is cruel. These patients are really, really difficult to manage, and the change is going to be quick, and the changes will happen suddenly, and you're going to have to adapt as quick as you can. So she came over and gave us lots of information. And to be honest, this is almost 4 or 5 days after we've been informed of the diagnosis, so there's a lot to take in. And to be honest, I think at that time I'm still shocked by it now. And at that time it was really raw. And, she was just giving us so much information about what's going to happen, how they're going to deteriorate, how things are going to come to an end, the fact that he's now at a risk of, further prolonged seizures. And she did say that in Lafora disease, these patients, these children, they die of either a seizure that kills them, or they die of a chest infection that doesn't get better, because they are at a risk of aspiration, because their swallow becomes very, very poor. And with all the information she gave us, there's a couple of things that stuck in my mind. So one thing she said was, now we know that this is not epilepsy. We know this is Lafora disease. And she goes, he is going to continue to now have prolonged seizures. So she said, next time he has a prolonged seizure, so a prolonged seizure is a seizure longer than 5 minutes, and that's what we call status epilepticus. So she goes, the next time this happens to him, you must let the A&E team know. So when you take them to the emergency department, just please let them know that this is Lafora disease. This seizure is part of Lafora disease, and that the medication that would normally be given as part of the seizure management protocol in A&E, some of the medications on that protocol actually make the seizures worse in Lafora disease. And she said that's what she experienced with her children. So, of course, I take that as very, very important information. She also says to me, when these children have these prolonged seizures, there's always something underlying that is driving the seizures. And she said that in her children, they would always have a chest infection. So she again said to me, when he goes to A&E, it's really important that a chest X-ray is done as soon as they can, because once they see on chest X-ray there's an infection, they can start treatment. The quicker you start treatment and the quicker you get on top of the infection, the less the chance that these patients will have further prolonged seizures, which to me just makes perfect sense, right? So on the 11th of March, whilst my nephew is staying with myself and my parents and my younger brother, he ends up having a seizure which lasts 17 minutes. I then take him to A&E because his parents weren't around, and I inform his parents that we're going to A&E. Once I get to A&E, I obviously recognise that the COVID rules still apply, and only one person can be by my nephew. And I thought, well, soon his parents will be here, and then I will have to leave the department. So this is my only opportunity to hand this information over that was given to me by the mother of them 3 children, which is, if he's now in A&E to have another prolonged seizure, and it gets past a certain time, and you start using the other drugs on that protocol, I've been told that some of those don't work. But anyway, at that point, his seizure had terminated. So it's not like any of the information that I was going to give them was going to then now have a direct impact on him, because it's not like he was still having a seizure. So it's not like I was obstructive or didn't allow them to do their job. I was just trying to pass the information over. The other thing I was trying to do was explain to them about the fact that they could have a chest infection and let's get the x-ray done. But unfortunately, for some reason, the staff in the department would not listen to me and were quite obstructive, and made comments such as, "You're not his dad. You surely don't know more about the condition than his father does. You don't have parental responsibility, so we're not going to listen to you." And essentially didn't listen to me. So we got to the A&E department at 10 o'clock. It wasn't until 12 o'clock that the attending doctor came to review my nephew. At that point, I honestly thought, okay, this doctor will hear what I've got to say, and I'll be reassured that somebody's heard what I've got to say. But when she came, she also decided to take the same stance that I didn't have parental responsibility. I clearly don't know more than the parents about this condition. She doesn't want to speak to me, and she was actually really rude and obstructive and quite aggressive towards me. I was visibly upset. I was confused as to why she was treating me this way, and I didn't understand why she wouldn't listen to me. And she just kept saying, "I don't want to talk to you. I've come here to speak to your nephew." And then she's trying to wake him up, and I'm thinking, if you want to take a history, take the history from me. I was with him for that period of time, and there is something called the collateral history. Take the collateral history from the person that was with him. I will tell you exactly what happened. I don't know why you're trying to take the history from my nephew, especially me knowing that he now has speech impairment, so he can't even formulate a full sentence.
And he's just had a seizure.
And he's had a seizure. And then she's asking him questions like, "Did you wet yourself?" And I'm thinking, that's not appropriate to ask him. He's already upset with what's going on. He's had this diagnosis. You don't need to ask him them inappropriate questions, right? Anyway, at that point I thought, I'm not going to get anywhere with this doctor. So I decided the right thing to do would be to escalate. And that's exactly what I did. I went to reception, I left the bedside, and I asked to speak to the consultant on call. In that time, my nephew's dad turned up. He went to the bedside, and the reception team managed to get the consultant over. So then I spoke to the consultant in charge. Again, I was upset, frustrated. I explained the diagnosis that my nephew had been given. I explained the information that was given to me by the mother of them 3 children. And I asked the consultant, had he heard of Lafora disease? And he said to me, I've never heard of it. This is the lead clinician that night in A&E telling me that he doesn't know what Lafora disease is. Anyway, after he heard what I had to say, he said to me, well, what you're saying is reasonable. Like, yeah, we can get a chest x-ray, and, what you're telling us about the medication, fine, we'll make note of that. I, at that point, said to him that I wasn't happy with how that doctor had treated me. I wasn't happy with her tone and her behavior, and I wanted to put in an official complaint against her. To which he said, well, you have a right to do so. He then said to me, look, your nephew's father is here. I can't have you by his bedside because of the one visitor policy.
Mhm.
But at the same time, I don't want you to just leave the department just yet. So could you please go and wait in reception just in case I need you again? And I thought, yeah, that's absolutely fine. Like, I will do as you say. So I went to the reception and I sat there. And you know what? I still remember looking up, and there was a camera right above me, and opposite me was a receptionist. And I just sat there, like, reflecting on the last few hours, visibly upset, crying, just trying to make sense of what was going on. And then I look up, and I see that doctor coming towards me. And as soon as she sees me, she starts having a go at me again. You must leave the department. What are you doing here? Why are you still here? Can you leave? And at that point, I thought, God, what is wrong with this woman? Like, what is her problem? So I just looked at her and I just said to her, I said, you need to go and speak to your boss. To which she responded, what do you mean? You need to leave the department. Like, thanks for bringing your nephew here, but you need to leave the department. I said, no, I suggest you go and speak to your boss. And this kind of went on for a couple of minutes. She kept telling me to leave, and I kept saying to her, go and speak to your boss. In that time, the consultant turned up just behind her. And as soon as he came, I just looked at him and I said, this is what I mean about your colleague's conduct and attitude towards me. I don't understand why she's behaving this way towards me. And now, once again, I'm telling you, I will be putting in an official complaint against her. And at that point, I asked for her GMC number and her full name and her position within the department. He then asked her to go back to her workstation, told me to remain in reception, and then about 5 minutes later, he came back and took me into a separate room. And at this point, I'm really upset, and he apologizes for what's happened.
Mhm.
We have a bit of a chat, and he then says to me, well, now we've done everything that you've said, which we agreed to, which made sense, and I would now suggest that you leave the department. Yeah, fine. I will leave the department. Like, thank you very much for listening to me. I will now leave.
Mhm.
Yeah, so I leave, and I now wait for my transport to turn up to take me home. This was around 1:30 in the morning. So I'm on my way home. Around 2:15, I return back to the department because I get a phone call from my brother saying that my nephew has now woken up and is asking for his mobile phone. And it turns out that I'd picked his phone up and put it in my pocket. So I go back to the department. So I enter the department at 2:15. I'm back in that same reception area. The reception is just in front of me, and just behind the reception is where my nephew was. And it has now been about 45 minutes since I initially left the department. So I thought, well, maybe I should just find out whether my nephew is still in the department or whether he's actually been transferred to the pediatric ward. So I asked the receptionist whether she could find out if my nephew is still there. So she kind of goes off, returns after about 5-10 minutes, and then says to me, you're going to have to wait because all staff are busy to find out. And at that point, it was 2:30 in the morning. Honestly, I'm tired. I'm really tired. I'm frustrated. And then she tells me I have to wait. And at that point, I say, you know what? That I'm not waiting. And I go through the doors, go around the corner, and see that my nephew is still there. And I literally hand his phone to him, and I turn around to leave, and guess who's standing behind me?
That doctor.
That doctor is standing right behind me. So I then try to leave the department, and as I leave, she follows me and keeps making comments. Why are you back? Why are you here? What are you doing? You need to leave, blah, 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 right? Etc., etc. I then stop. I look at her, and I say, I've already told you I'm putting in an official complaint against you. I know people. Just wait and watch and see what's coming your way. And by that, Mazin, what I meant was, I know people within the hospital, I know people within the program, I know who to send my complaint to. So that's what I meant by wait and watch what's coming your way, because that's all my intention was, to put in a complaint. At no point have I threatened to harm her in any way. So yeah, and then I leave the department. I've gone.